Assalamu alaikum dear students. Today we will discuss hematology MCQs. The most common anticoagulant used for CBC test. Option A heparin, B EDTA, C citrate, and option D fluoride. So the correct option is B EDTA, ethylene diamine tetraacetic acid. A high MCV mean corpuscular volume indicates option A microcytic anemia, option B macrocytic anemia, option C normocytic anemia, and option D spherocytosis. So the correct option is B macrocytic anemia. Which WBC type is most abundant in normal peripheral blood smear? Option A lymphocytes, B neutrophils, C monocytes, and option D eosinophil. So the correct option is B neutrophils. Subscribe now and press the bell icon, never miss an update from Ali Technologist. What is the normal hemoglobin range for adult female? Option A 10 to 12 gram per deciliter, B 12 to 15.5 gram per deciliter, C 14 to 18 gram per deciliter, and option D 8 to 10 gram per deciliter. So the correct option is B 12 to 15.5 gram per deciliter. Which condition is associated with target cells in blood smear? Option A iron deficiency anemia, B thalassemia, C pernicious anemia, and option D sickle cell anemia. So the correct option is B thalassemia. Which anemia shows basophilic stippling in RBCs? Option A iron deficiency, B lead poisoning, C sickle cell anemia, and option D autoimmune hemolytic anemia. So the correct option is B lead poisoning. Which blood cell is responsible for oxygen transport? Option A leukocyte, B erythrocyte, C thrombocyte, and option D lymphocyte. So the correct option is B erythrocyte. What is the normal range of WBC count in adult? Option A 2000 to 4000 per microliter, option B 4000 to 11,000 per microliter, option C 12,000 to 20,000 per microliter. So the correct option is B 4,000 to 11,000 per microliter. What does a low MCHC mean corpuscular hemoglobin concentration suggest? Option A hypochromic anemia, B hyperchromic anemia, C hemolytic anemia, and option D aplastic anemia. So the correct option is A hypochromic anemia. Which test is used to diagnose sickle cell disease? Option A hemoglobin electrophoresis, B osmotic fragility test, C Coombs test, option D reticulocyte count. So the correct option is A hemoglobin electrophoresis. Sickle cell anemia is caused by a mutation in option A beta globin chain HBS, B alpha globin chain, C spectrin gene, and option D G6PD. So the correct option is A beta globin chain. Which anemia is caused by vitamin B12 deficiency? Option A iron deficiency anemia, B megaloblastic anemia, C sickle cell anemia, and option D aplastic anemia. So the correct option is B megaloblastic anemia. Hence bodies are associated with option A G6PD deficiency, B thalassemia, C autoimmune hemolytic anemia, and option D aplastic anemia. So the correct option is A G6PD deficiency. What is the most common cause of microcytic anemia? Option A, iron deficiency. B, vitamin B12 deficiency. C, folate deficiency. And option D, lead poisoning. So the correct option is option A, iron deficiency. What is the hallmark feature of iron deficiency anemia? Option A, microcytic hypochromic anemia. Option B, macrocytic RBCs. Option C, target cells. And option D, Howell-Jolly bodies. So the correct option is A, microcytic hypochromic RBCs. What is the primary function of platelets? Option A, oxygen transport. B, hemostasis and clotting. C, immune defense. Option D, phagocytosis. So the correct option is B, hemostasis and clotting. Which test confirms iron deficiency anemia? Option A, low serum ferritin. B, high hemoglobin level. C, elevated transferrin saturation. And option D, increased haptoglobin. So the correct option is A, low serum ferritin. Thank you for watching my videos.